Hello, Katz Chiropractic. Dr. Shauna and I are asked often, and we show often in our office, the right way to sit to stand, the right way to lay down and get up, the right way to lift, the right way to keep your neck in a position when you're on your phone or reading, and also some exercises that you can do when seated so that you can minimize the negative effects of just sitting there. So first thing we're going to do is let me just show you the best way to lay down and get up. So what I always tell you, there's a great way to keep good posture. Good posture is we want what's called your manubrium, this part of your sternum, just to be up, right? You could have horrible posture here and you hear people say, squeeze your shoulders together, but that doesn't do anything, right? And you shouldn't need a lot of muscular contraction to keep a good posture. That's why we want to fix your sagittal alignment, the curve of your spine. So you want to be upright. When you start to round, this is when problems can occur. You start to load the discs and the joints. We want to keep that pressure off. So when you go to lay down or get up, and let's say you just lay down and get up just twice a day, those are 2 times that you could either help your spine or hurt your spine. So we're going to show you, if you're laying down, and we see patients that do this all the time, I ask them to lay down as a test, and they do this. This is terrible. Look at the position of our spine. We're flexing a lumbar spine, we're increasing the force, and look where our head is. So don't do that. So the way you want to do it is keep yourself upright. And obviously on these tables it's a little harder because they're more narrow, but if compared to your bed. So you're going to just stay here, keep this straight, and then you're going to fall like a tree, keeping all this straight. As you get down, you're then just going to tuck your shoulder onto your back. When you're on your back and you go to get up, if you do this, look, your head is forward, you're flexing your lumbar spine, you're increasing the pressure of your discs and joints, leading to potential failure. And if you already are having a problem in that region, you're now just stressing it. Why stress it? So you're going to turn to your side, you're going to use leverage and gravity at the same time. As you swing your legs off and keeping this all straight, you're just going to lightly push here. And you're up. Less pressure, less strain. So now let's go from standing or sitting to standing. Sitting to standing doesn't seem like a big deal, but when your back is really acute and painful, sometimes getting up can really hurt. So what we want you to do is you're going to get your butt to the edge of the chair, the table, whatever it is that you're sitting on, keeping this all straight. You're going to get as close to the edge as you can. It almost feels like you're going to fall off, but don't fall off. From here, you're going to turn your whole body together. You're not rotating, This moves as a unit, and now watch. This leg can come all the way back, this leg forward, so you're still up, and all you're going to do is you're going to push with your back leg, keeping your back straight, and you're off, right? Less pressure. Now the same thing, when you come to sit down, if you just do this and you plop down, that increased axial load or pressure can hurt. So you're going to do the same thing as getting up as down. As you're going to come to your seat or table, the leg that's closest, you're going to take a really big step like you're lunging. This is all straight, you're not rounding. You're going to keep lunging until your butt cheek hits the table. And then from there, keeping this all straight and together, you're going to turn and now you're comfortable. So let's go over proper mechanics when you're reading, okay? Sitting, watching TV, whatever it is that you may be on your phone. So I'm going to do this from the side. So from here, if you're reading and you're doing this, what are you doing? You're increasing flexion into the region, which is causing more compressive load on the discs. You're increasing the length of the spinal canal, is increasing the irritation of the central nervous system, so on and so forth. So what you're going to do is you're going to take your manubrium, which is right here, and you're just going to lift. And a lot of this comes from here, right? From kind of your mid to lower back, you're lifting. Now you're in a good position. So when you're reading, you're going to try to have the information here. The difference, watch my neck, between here and here or here might be subtle, but it does make a big difference. So keeping that into a better position, right? Keeping your spine here compared to here, here, or here, or here, right? Trying to keep yourself as upright as possible. Now I know when you're on your phone in public and you're on your phone, people might think that you're taking pictures or videos of them. Who cares? You're not. You're not hurting your back and your spine, and that should be your primary focus. So now, let's go to lifting, okay? The best way to lift is with a good posture, okay? Great posture is not rounding. What I tell my patients all the time is pretend everything weighs 200 pounds. I did have one patient after 20 years of practice of saying that, actually had a really good comment, and I said, okay, pretend that's 200 pounds. And she's like, I just wouldn't lift it. And I was like, well, that's a really good point. So pretend it's 50 pounds, right? You have to lift something. If something was 50 pounds, whether it's, this light box of tissues, pretend that that's 50 pounds or 100 pounds. If it was 100 pounds and you were getting ready to lift, you're gonna keep this upright. Almost like if there was a cup of water sitting right here, it won't spill. You're here, right? And then you're gonna grab, the closer in it is compared to here, the less stress on your back, and then you're gonna lift. So same thing, I don't care how light it is, when you go to lift it up, it's here. If you're opening the refrigerator and you wanna see what's in it, doing this, you're just loading your back. You could do this, where you're loading your muscles so they can come back stronger. I want to discuss, what I'm asked a lot, best way to sleep. What's the best sleeping position? I get asked this multiple times a day. And so does Dr. Shauna. First and foremost, you need sleep. If you're trying to get in the best position, but you're uncomfortable and it's keeping you awake, that's not good either. So you're gonna try to find the best comfortable, the most comfortable position where you can still sleep that's decreasing the amount of pressure on your spine. So look, if you're sleeping and this is good posture, this is what I want you to look like when you're sleeping, right? If we're from here and you're on your back, I don't want the pillow pushing your head forward. We want the pillow here so you're getting more of that lordotic curve. If you're laying on your side, this is what you should look like. If I'm laying on this side, I don't want, I'm gonna lay down the right way, I don't want a pillow that's so low, your head is here, and I don't want a pillow so high that your head is here, because then you're just laterally flexing your neck in the wrong position. So good sleeping position is, you're on your back, good position, you're on your side, you're in a neutral position. So these are some things we just want you to have to add into your normal routine. It doesn't take any additional time. You're just doing the exact same things, sitting, laying down, that is helpful without irritating your body. Now I'm gonna go over one other thing too. Exercises for your spine while you are just sitting, okay? Sitting is horrible for us, okay? So sitting, whether your back is good or bad, is terrible. So how do we get our body to minimize the negative effects of something that we have to do? So one thing that you're gonna do is when you're sitting, as an exercise, I don't care if you're driving, I don't care if you work at a desk job, when you're sitting, bad posture is terrible, you're loading the discs, but what else is really bad is no movement. The way that the discs and the joints get any type of nourishment and nutrition is through movement. It gets nourishment in, it gets waste out. So when you're sitting, what I want you to do is you're just gonna start to rock your back through a pain-free range of motion. Now what you're doing is you're still doing the same thing, you're driving, you don't have to do it 24/7, but take the time to get your body to move. Take your time to start to nourish these joints so you're minimizing the negative effect of sitting. There's load on it and no movement. You can at least start to minimize the load and increase movement so you start to nourish and hydrate the discs and the joints. I hope you found this helpful, and give us a call at Katz Chiropractic and Rehabilitation Clinic with any questions you have, and we'd be more than happy to help you. Thanks so much.